Assalamu alaikum. Today we are going to discuss immunoassays. What is an immunoassay? An immunoassay is a test that uses antibodies to identify and measure the presence or concentration of a substance in a biological sample. ELISA is a type of immunoassay. There are 4 types of ELISAs: direct ELISA, indirect ELISA, sandwich ELISA, and competitive ELISA. Now we are going to discuss them one by one. The first one is direct ELISA. In direct ELISA, an antibody is immobilized on a plate and an enzyme conjugated antibodies that's specific to the antigen is added. The enzyme substrate is then added to detect the enzyme, which produces a signal that proportional to the amount of analyte in the sample. Now indirect ELISA is a two-step ELISA which involves the binding process of an primary antibody and labeled secondary antibodies. The primary antibody is incubated with the antigen followed by the incubation with the secondary antibodies. Now we will discuss this sandwich ELISA. The principle of sandwich ELISA is to use two antibodies to detect a target protein in a sample. In this antigen is sandwiched between two antibodies, the coated antibody and the upcoming secondary antibody, which makes it highly sensitive and specific. Now we will discuss the further types of immunoassays: radioimmunoassay, enzyme-linked immunoassay, enzyme multiply immunoassay, affinity chrome-mediated immunoassay, clone enzyme donor immunoassay, partial enhanced turbidometric immunoassay, now fluorescence polarized immunoassays. These are the types of immunoassays which we will discuss further. The one we will discuss here is the enzyme multiplied immunoassay. Enzyme multiplied immunoassay is a technique that measures the concentration of drugs and proteins in urine and serums. Principle uses enzyme as a label instead of radioactive label, eliminates the use of special handling and disposal issues. Reaction components are absorbed or bound to the surface of a solid phase, commonly a well of microtiter plate. Absorbance is measured using microplate reader. Now the procedure of EMIA: mix sample containing drug with antibody, then incubate, add fixed amount of enzyme bound drug, then incubate, add substrate and cofactor, then incubate, then measure the absorbance. Non-linear relationship between absorbance and concentration will be observed. Now the clinical utility: clinical value and sensitivity of caffeine serum clearance measurement has been evaluated as an indicator of hepatic disease. After 17 hours, 300 mg of caffeine citrate was administered orally. Now we will discuss some of the advantages of EMIA. The first one is speed and efficiency. EMIT assays are fast, providing quick results, which is crucial in clinical diagnostics. Highly sensitive and specificity. Cost effective. EMIT assays are generally less expensive compared to other immunoassays such as ELISA. ELISA is also an EMIA assay. Now the no radioactive materials. They use no radioactive materials in EMIA. Homogeneous assays. They are homogeneous assays and they are quantitative homogeneous assays which give us quantitative results as well. These were the advantages that we discussed. Now we will discuss some of the disadvantages. The first one is potential for interference, lower sensitivity compared to other methods, and the third is limited range of analytes, requirement for specialized equipments, and less common in some applications. These are the some